This is Office RX, where we prescribe solutions for smarter medical practice growth. Brought to you by PAHCOM, the Professional Association of Healthcare Office Management. Are you ready for today's dose? Let's get started. Hey everyone, welcome to Office RX, your go-to for navigating the wild world of healthcare management. I'm Trinity, and as always, I'm here with my work buddy, Marcus, who's basically a walking encyclopedia on today's topic. Marcus, I'm really curious. What's the deal with all these vaccination policy changes hitting small practices?
Oh, Trinity, you're diving right in, huh? All right, let's unpack this. The vaccination landscape's been, well, a bit of a roller coaster lately, especially for small practices, and across several specialties including general practice, pediatrics, OBGYN, you name it. The big shift came when HHS Secretary Robert Kennedy Jr. took over in February 2025. Since then, we've seen some serious changes, particularly around COVID-19 vaccines and how practices need to adapt.
Okay, hold up. COVID-19 vaccines? I've heard things are different now, especially for kids and pregnant women. What's going on there?
In May 2025, HHS announced COVID-19 vaccines aren't routinely recommended anymore for healthy kids aged 6 months to 17 or for healthy pregnant women. Instead, it's this shared clinical decision-making model. Fancy way of saying, doctors and patients gotta weigh the risks and benefits together. Problem is, this could mess with insurance coverage, since Medicaid and private insurers often follow CDC recs. Oh, and the Vaccines for Children program? Its support for COVID-19 shots is kinda up in the air, which might hit patient wallets hard.
Wow, that's a lot. So practices like pediatrics or OBGYN, how are they supposed to handle this? I mean, patients must be confused, right?
Absolutely. Confusion's the name of the game. For pediatrics and general practice, it's about documenting every vaccine conversation, especially if parents opt out. Gotta keep those records tight for patient care and, legal reasons. ACOG still backs COVID-19 vaccines for high-risk pregnancies, says it cuts infant hospitalizations by 61%. But with the new model, docs need to have those heart-to-hearts with patients, really lay out the evidence.
And I heard something about the CDC's vaccine committee getting a total overhaul. That sounds intense. What's the story there?
Oh, it's wild. On June 9, 2025, Secretary Kennedy sacked all 17 members of the Advisory Committee on Immunization Practices, ACIP, claiming conflicts of interest. New folks are coming in for the June 25 meeting, which will cover vaccines like flu, RSV, and HPV. Critics, like Senator Susan Collins, are worried the new appointees might not have enough vetting, and that's got practices on edge, especially since ACIP sets the tone for vaccine schedules.
Yikes, that's a shakeup. So with all this uncertainty, what can small practices actually do to keep their vaccination game strong?
Great question. First off, patient education's huge. Vaccine hesitancy's spiking. AAP says over half of pediatricians deal with misinformation from patients weekly. Practices need to start vaccine talks early, like at well-child visits for pediatrics or prenatal checkups for OBGYN. Use clear resources like AAP or ACOG guides and, really listen to patient fears before dropping facts. Like, did you know nirsevimab cuts RSV risk by 90%? That's a game changer for parents.
Okay, that makes sense. But what about the logistics? Small practices don't exactly have endless resources.
Right, it's tough. Streamlining's key. Pre-book flu vaccines and nirsevimab to avoid shortages. Integrate shots into routine visits, like Tdap during OBGYN checkups, or pneumococcal vaccines for older adults in internal medicine. Oh, and keep an eye on insurance policies for COVID-19 vaccines under this new model. Document medical necessity for appeals, especially for immunocompromised patients in allergy immunology.
Got it. Any other tips for staying ahead of the curve?
Oh, for sure. Community engagement's a big one. Host flu or RSV vaccine clinics, especially in areas hit by CDC grant cuts, like those 50 canceled clinics in Texas. Partner with schools or health departments to push routine vaccines and share wins, like how maternal RSV vaccines are dropping hospitalizations. Also, stay plugged in. CDC's got training on vaccine storage. And stay engaged with members of your professional community through tools like the PAHCOM forum.
Man, Marcus, you're sharing so much knowledge today. I feel like small practices have a solid playbook now. Anything else listeners should know?
Just this, things are moving fast. There's a new 31-valent pneumococcal vaccine study coming in 2026, and ACIP's decisions could shift recommendations. Check out the CDC's schedules, AAP or ACOG, for the latest, and peek at our show notes for links to dive deeper.
Well, that's all the time we have for today's dose of Office RX.
Until next time.
See you at the forum.